Good morning. My name is Marty Hapflish and I am a nurse that specializes on foot care. And today I want to answer some questions about diabetes and why they have burning feet. It's actually very easy. If you have a brain, and you can see the eyes pop out, and you have a nerve running all the way from your brain, and you see it's a long nerve. One of those things I got at the playing fields. Okay. You have a nerve and it has to reach all the way to your foot. You see, shoe. It's a long way to travel. And when this nerve gets damaged by high blood sugar levels, it affects the way that the nerve works. And how it works is that it gets damaged, and when you bump your toe and you're supposed to say ouch because it reached your brain and you realize that it's painful and it traveled all the way down the nerve, it doesn't actually happen, or it happens very slow, or happens haphazardly, and then you end up having burning feet and no feeling at the end. So it's a progressive thing. It doesn't happen overnight. It happens because of high blood sugar. Now, what happens if your blood sugar levels are very high? That means you have thick blood and it can't reach all the itty-bitty little veins that serves your body. And one of the things that it serves is your nerves. And the first one to be affected is your foot. Now, if you look at this foot picture, you'll see that it has a lot of tendons and muscles and blood and veins that it has to service, and if that doesn't get serviced, it will die. That's when you get tendons that shorten and muscles that deteriorate, and then bones start moving, and you get hammer toes and claw toes, and you also get burning feet and feet that the feeding goes away. So, and then you become high risk for having ulcers, and that could lead to amputations. And that's what we all want to avoid. So, just to explain it better, I will show you. If you have a nerve cell, dendrites, right? This is a very long cell, can you see? And it's got a sheath around it, myelin sheath. And this gets damaged. And that means that the speed and purity of the signal is affected, and that leads to problems in diabetes. So that's the reason why. And then I will also say that it looks like a wire. You can see this got caught in my car door, but you can see it sticking out. And this will not, I threw it away. I had to buy new earphones. Unfortunately, you can't buy new feet, and this is you have to take care of them while you have them. And yes, so how do you go about taking care of your feet better? Now, the first thing is, if you're a diabetic, you have to go to a specialist in feet once a year to make sure that you have feeling in your feet, and they will test it with a little tester to make sure that your feet is still okay, and the nerves. And then if you start losing your feeling in your feet, you have to come in every 6 months so we can make sure that you're up to the standard you want to be. It's just to test before and afters. You can't just go on one test. You have to see if there's progress, that we can plan for your future and make recommendations that will help you stay independent longer. If you've had an ulcer, and if you've had an amputation, it's recommended that you see somebody every 3 months, because now we're in crisis management. We have to keep you out of the hospital, which is very expensive. So let's say you don't have burning feet yet. The best thing to do is to keep your sugar stable, and then the next thing would be to make sure that you know what to do when you do get an ulcer. So keep your sugar stable, prevent ulcers. That means every time you walk through the door, you have to check your feet to make sure that they're intact, because your skin is the most amazing organ. It keeps everything neat, tidy, clean, and safe. And if it's broken, you have to pay attention. So make sure that you don't have cracks in your feet, that you dry in between your toes, especially the two little toes. That's where men usually fall out of the carriage because they don't dry properly, and then it becomes mush and high risk for infection. And then also, when you have an ulcer, you must know how to do wound care. Now, wound care is very easy. Salt water, saline. Now, I prefer you buy it from the shop because it's the right mixture, and it's an isotonic solution. So that just cleans the wound. It dilutes the germs. It doesn't kill it. Because if you kill the germs, you also kill the good guys. That's the cells that's going to regenerate. So you have to just dilute it. So rinse your wound with salt water, and then you pack it with salt water. You can protect the skin with some Vaseline if you want, or some skin protector if the salt is too strong for your skin. But the bottom line is it has to stay wet, because then the cells will regenerate. They love swimming. And then if you've done the wet wound healing, and that means heals faster, it speeds up the process, and then your risk for infection of a wound that takes long to heal is limited. And then that's it. If you get an infection, I recommend something like betadine to suck out the pus. And if you have a wound that you want to keep closed and maybe cushion a bit, you can put on a gel band-aid. It's made with it, made for that purpose, and then you can keep that on longer as well. But it is more expensive, yes. So that's it for wound care. So overnight you can put some gauze on, cover it up, and then make it wet, because if you make it wet first, it won't stick. That's one of the things. And if it's in the daytime band-aid, you just make the little cushion wet. So it's easy. You know, it takes 3 days for a normal person to heal a wound, 2 weeks for a diabetic, because they have high sugar levels, and there's a bit of a challenge. That means you have to keep your sugar issues level and low, so that you can make sure that healing takes place, and drink a lot of water and eat protein, because that helps the body recover and rebuild the cells. And you can also make sure that you could keep your feet up for circulation. Don't walk on a foot that has an ulcer, please. I've seen ulcers as big as this, and it's never going to heal if you keep on walking on it, and it's a problem. So you get special shoes you can adapt to make sure that you don't walk on that part of the foot. And be careful if the one foot has an ulcer and you compensate with the other one, because it might just be that foot gets exhausted and becomes the problem again. So you don't want to create more problems. That's why you need to see a professional. Rather be safe than sorry. So that's it. So if you have a problem with your feet, you can ask me. I will try and answer them. And just to recap, you've got a nerve cell. It gets damaged because it doesn't get blood, and then it dies off, and then you have a wire that looks like this. We can't transmit the signal, and then your brain and your feet can communicate. And yes, it becomes a problem. So yes, I'll see you next time. Send me your questions and I'll try and answer that. You can follow me on Facebook. I'm on Feet First and Diabetes Health, and you can also follow me on Instagram, Foot Care Feet First. Thank you.